let's talk today about breathing in labor and in childbirth. I'm Tina B, a labor and delivery nurse. Today we're talking about breathing, and while that seems really simple, if you go do a real quick Google search on breathing techniques for labor and childbirth, you're going to come up with a ton of information. I mean, I'll wait if you want to go do it, or you can watch this video because I am going to go over breathing techniques for labor and for pushing and for crowning, so you can have all of the techniques lined up that you want to utilize in your childbirth experience. During early labor, our cervix is starting to do some of that changing, right? Maybe it's dilating a bit, maybe it's thinning or softening or moving forward. These are incredible changes because we need them to happen on our way to childbirth. During this period of time, feel free to use any type of breathing technique that you have that's going to help distract you a little bit and help you cope with the pain of the contractions. But these contractions, they're going to be less often and less intense as they are during active labor. And when we move towards around 6 centimeters, now we are said to be in something called active labor. And during this time, these contractions are going to be more intense and they are going to be more often and they're going to last longer, around 45 to 60 seconds. So you're going to need to start utilizing some of these breathing techniques to get you through these longer, more painful contractions. First one I want to talk about, we're going to call it a yoga style breath or a Bradley breath, or I like to call it a balloon breath. Now these are slow and intentional breaths, and around the same amount of time that you are going to inhale, you are also going to exhale. Now people always say, like, should I inhale through my nose or my mouth, or what should I do? Do whatever feels good to you. But I will say, generally speaking, if you're going to inhale through your nose, it kind of mentally makes you slow down your breath. For these breaths, when you inhale, you are going to expand your belly out, and when you exhale, your belly is going to come back in. So it's a really nice trick to actually put your hands on your belly when you're doing these breathing techniques in active labor. So what does a balloon breath look like? It's going to look something like this. Hands on your tummy, and you are going to breathe in 2, 3, 4, and then exhale 2, 3, 4. So the amount of inhale is around the same length of time as your exhale. Your exhale might be a little bit longer to make sure you push all of that air out of your lungs. Slow and intentional, and it actually makes you slow down to focus on your breathing to help you cope with those contractions in active labor. These types of intentional breaths, they're going to help to keep you oxygenated, but in turn, it's then going to help keep baby oxygenated. What we don't want to do is hyperventilate, because that is going to make you feel really bad. It's going to make your muscles cramp up, and it's not getting an adequate blood flow down to baby. All right, you have breathed your way. Why does that sound weird? You've breathed your way through active labor. Now you're moving towards transition. Transition is the time where the rest of the cervix is getting out of the way as you move towards fully dilated. It's going to start around 7 to 8 centimeters, and you're going to know what's happening because a lot of people report feeling almost panicked, and I hear a lot of, I can't do this. Now, this is because this part of labor is the most painful part of labor, but it is also the shortest. And I'm going to let you in on a secret here. You can do this, but let's get you some breathing techniques to help you to do that. Now, these breathing techniques in transition, they are different than active labor. It is now short, shallow, and purposeful. We're trying to do relaxation, but we're also really focused here on coping with the pain of the contractions, which are longer, by the way. They're now lasting 60 to 90 seconds. These breaths are known as Lamaze breaths, and they're really unnatural, which is good because when you're doing an unnatural pattern of breathing, you have to really think about it to get it right. And this mental game is going to help distract you from the pain of the contractions. And please remember, during transition, just get through these contractions one contraction at a time. Also cool about Lamaze breaths, the short, shallow pattern of them is going to help you cope with the sensations of wanting to bear down or push down with your contractions, because we don't really want to be pushing down on a cervix that is not fully dilated, because it can actually cause cervical swelling. And when we're talking about childbirth and cervical swelling, I mean, the two, they don't really go together that well. All right, Lamaze style breathing. This is going to be 2 quick ins and 2 quick outs. And you're going to want to do most of them through your mouth. And that's good too, because sometimes that breath passing by your mouth is also further distracting, which is going to help you with pain control. Now, you are going to make noise with this one, okay? And that is totally fine. Now, the noise that you make, whatever you choose, that's the one that's going to work for you. What feels good in that moment, that's the one you got to do. So go with it. This could sound like, or it could be like, or it could be like, hee, hee, ha, ha, hee, hee, ha, ha. Whatever feels good, that's what you're going to do. And also, have your water nearby, because that's very, very drying on the throat. Here's something cool. A study in the Journal of Medicine in 2021 talked about this style of breathing when combined with the support from a family member or a spouse or a doula. It actually decreased their perception of labor pain and helped them to relax physically and mentally. Let's talk real quick about a breathing technique you may use, but you may not use it. This is going to be like you've gotten to fully dilated, but maybe your baby is still high up in your pelvis and you don't have that sensation of wanting to push yet. So we're going to do something called laboring down, and we need a new breathing technique for it because it's very different from transition. We don't need those short, shallow breaths. We need a slow inhale and a slow exhale, very similar to the balloon breath, but here's where it's going to differ. You're going to take an inhale and you're going to move your tummy out with a slow inhale through your nose, but then instead of bringing your tummy back down with the exhale, you're going to leave your tummy kind of pushed out and you're going to exhale, and very quickly you're going to see the difference. Do it with me and then you'll just know what I'm talking about. So you're going to put your hands on your tummy. You're going to take your inhale. Ready? Inhale. 2, 3, 4. Exhale through your mouth with your tummy out. See how it almost feels like you're sort of pushing down without pushing down? What you're doing is you're softening your pelvic floor and you're kind of passively bringing baby down even lower. So it's not the same as a balloon breath, but it is slow inhale, slow exhale. It's purposeful, it's relaxing, and it's going to try to get you to labor down, meaning you're fully dilated, but you're not actively pushing baby out yet. All right, it's happening. You're feeling the pressure. It's time to push your baby out. How are we going to breathe now? There are 2 main ways that you can breathe when you are pushing your baby out. We're going to call them open glottis pushing and closed glottis pushing. Let's first talk about closed glottis pushing, because I really think that this is going to be the more common thing that you run into if you are doing any sort of coached pushing or if you're giving birth in the hospital, because this was how I was taught to teach patients how to breathe when they were pushing. It's really, really commonplace. This is where you take a big, deep breath in and you hold it all up top. You make no noise at all. No noise. All of that pressure down low, right out the bottom. Very quickly, you sort of start to see stars. Your eyes feel like they're just going to pop right out of your head. Closed glottis pushing does have an advantage though, because generally speaking, you are able to generate more downward force. So it can be really, really useful if we need you to move baby down and out a lot more quickly. However, when you're doing closed glottis pushing, you are in a deoxygenated state because you're holding your breath, right? You're not moving any air. And that can have an effect on baby and how they are able to maintain their heart rate through that contraction and following the contraction. This style of pushing is often reported as more fatiguing, and you might hear it referred to as purple pushing. In comparison, open glottis pushing, it looks a lot different. You're still going to take the same big deep breath in and fill up your lungs, but instead of holding all that air up here as you push and like feeling it all in your face, you are going to do a slow, steady exhale as you push in a downward motion. So it's going to look kind of like this. Or, so honey, how's it going? I'm just pushing our baby out. Did you pay for parking? Are we up to date on our parking? I mean, you can do whatever you want. The key here is that you are slowly exhaling that breath. You are then working in an oxygenated state as you are pushing, and generally speaking, baby is going to be happier with it. We did say that the force exerted down to push baby out might not be as forceful, but you are generally speaking going to be more relaxed and you are going to feel less stressed out as you're pushing your baby out. Open glottis pushing is going to work the best for you if you practice it before you go in to have your baby. Now, this is easiest if you don't have an epidural, but you can still do open glottis pushing with an epidural. The key message here, though, is practice this skill. And guess what? You have a ton of opportunities to practice this because you could practice it every time you have a poop. I know everything on this channel has to do with poop, but it's a great chance because you are pushing down to push your poop out. I mean, not as hard as you're going to push when you have your baby, but you're still pushing down. So when you go in to have your poop, take a big deep breath in and practice your open glottis poop pushing. I promise it'll be easier for you during birth. One more hurdle for you to get over before you can snuggle your little nugget, that is crowning and the famous ring of fire. So we need something you can utilize to cope with that burning sensation that comes along with crowning, because what we don't want is for you to rocket your baby's head out of your vaginal opening really, really quickly, because if we can slow it down and you can breathe baby down and out, then those perineal tissues, they have a chance to stretch out to accommodate baby's head, and then you can hopefully reduce your chance of a severe perineal tear. So what does that look like? That looks like small, controlled little pushes, and along with that is small, controlled breathing. So it's going to look like a pant, or it can be shh, shh, or you can blow out a birthday candle, or breathe over your tongue. It's going to be whatever you need to do to be able to slow it down and slowly breathe baby out. That was a lot, but I want you to know one thing. This is completely a choose your own adventure. You can combine any breathing technique you like with any part of your childbirth. And remember, what feels good to you in the moment, that is the right choice. I loved making this video for you. If you enjoyed it, go ahead and give it that thumbs up. Consider subscribing to the community if you want to learn some more. Check out this other video if it interests you, and I will see you in the next one.